Mr. Limbrick.
Thank you, President. My question is for the Minister for Health. It will be no surprise to anyone that the Public Health and Wellbeing Act has become the most significant piece of legislation in the state. Under the principle of proportionality, the Act states that actions should not be taken in an arbitrary manner. Under the principles in Part 8 related to the management of infectious diseases, the Act states as the first principle that the spread of an infectious disease should be prevented or minimised with the minimum restriction on the rights of any person. The first clause relating to the public health order states that if in giving effect to this division, alternative measures are available which are equally effective in minimising the risk that a person poses to public health, the measure which is the least restrictive of the rights of the person should be chosen. My question to the Minister is this: is the Minister confident that no arbitrary measures have been taken and that the measures have been taken with the minimum restriction on the rights of any person?
Ms. Shing on the point of order.
Thanks, President. I note that the first part of the question as posed may in fact fall foul of the anticipation rule, and so perhaps there might be some guidance from the President in relation to how in fact we should proceed with this particular question, noting that the question itself then went in a slightly different direction.
My understanding is the question is about the Act, it's not about the bill, so I will allow the question. Minister.
Thank you, and I thank the member for his question. And Ms. Shing is correct in that it does really bring into bear issues that we will be debating during the course of today. But nevertheless, what I would say to the member is that, as I have stressed to this House, and as I've stressed publicly time and time again, the Chief Health Officer has provided the government with advice in accordance with the legislation, and we have not hesitated to act in accordance with that advice. There are criteria set out in the Public Health and Wellbeing Act that relate to how these measures need to be put in place. It's certainly spelt out in the Act in terms of a state of emergency, and of course the public health directions sit under that state of emergency that provides the legal framework by which the Chief Health Officer can then sign off on those public health directions that do things like require a positive diagnosed case to isolate at home, that require employers to put COVID-safe plans in place, and other measures that have been proven and have been shown to be effective. They were shown to be effective in the first wave, and as we're seeing with the case numbers declining now in the second wave, are shown to be effective yet again. So we will continue to take advice from our public health experts and act on that advice, because we know from the modelling that we have been provided with the modelling that we have released publicly, without these measures being put in place, we would have catastrophic consequences. We would have more people's lives being lost and more livelihoods.
Order, Minister. Mr. Limbrick on a point of order.
Point of order. This is a very simple question. Does the Minister have confidence that the measures are the least restrictive on the rights of any person and that they're not arbitrary? Does the Minister believe that these things, that they are in line with the legislation? This is quite a simple question.
Thank you, but I cannot direct the Minister how to answer the question. Minister, to continue.
Thank you. Look, I did want to take a point of order on the member, because there are some restrictions in there around asking for opinions, asking for legal opinions. But what I would say to the member is that I'm absolutely confident that they're not arbitrary in nature, because they are based on public health advice. They're based on the advice of our experts, made in accordance with the Public Health and Wellbeing Act. We've acted on that advice. It's proven effective with the hard work of all Victorians. We are driving these case numbers down, and we will continue to act on that advice. And with the support of this House, hopefully today, perhaps in the wee hours of tomorrow, we will make sure that we can continue to put in place those public health measures that will continue to save Victorians' lives.
Thank you. Mr. Limbrick on a supplementary.
The Act also has an important principle of accountability. The bill states, the Act states, 1, persons who are engaged in the administration of this Act should, as far as practicable, ensure that decisions are transparent, systematic and appropriate. 2, members of the public should therefore be given A, access to reliable information in appropriate forms to facilitate a good understanding of the public health issues, and B, opportunities to participate in policy and program development. The CEO of the Small Business Council of Australia, Peter Strong, spoke on ABC Melbourne this morning describing the regular meetings that occur in New South Wales where business leaders work with the government on solutions. And we're told this doesn't happen in Victoria. My question for the Minister is this: does the Minister believe that decision-making has been transparent and representatives of Victorian businesses have had opportunities to participate in these solutions?
Thank you. Order. Minister.
Oh, I keep forgetting to take this off. Thank you, President. I've explained to the House before, each time that I've sought an extension of I've extended the declaration of the state of emergency, I have first sought the advice of the Chief Health Officer. That advice has needed to be contemporary to the assessment of the risk at that time, and that extension has happened in accordance with the requirements of the legislation. In relation to consultations with business and other parties, the Premier announced just yesterday that we're embarking upon those consultations. They are underway as we speak, and the Premier has also outlined that he will be outlining our roadmap for the easing of the restrictions this Sunday, that we need to continue to be guided by the evidence, to be guided by the public health advice. That means we continue to consult with industry and other stakeholders in our community, but we need to listen to our experts as well.